Let's talk about crystal touch NPR method. NPR stands for Neuro-Proprioceptive Rehabilitation. It's a little bit of a complex sounding name, but later on I will explain why every word in this name is necessary. As you can see here on the screen, we have certain foundation principles, and these principles we use during composing of our rehabilitation programs. I will start and go briefly through all of them, and then I will stop in more details on certain principles and techniques that you will may find useful also for your daily practices at home. Let's talk about, well, facial harmony rules. It may sound simple, and it is actually simple, but it's still very important. As you know yourself, when Bell's palsy happens, first thing that is becomes affected is balance of the face. Face gets out of balance, and the whole recovery process involves slowly regaining that balance, and unfortunately very often, even after a long time since the onset, the balance in the face remains distorted. Well, there are certain rules that we apply and also teach our patients that will help him or her to, by following certain rules, develop again a proper routine so that will be better and easier to regain balance in the face. Second one, going to the right, associative thinking. We will quite often underestimate how much our ability to imagine things and to associate certain things with our already existing experience can help us in recovery and in rehabilitation. For example, they say that in ancient Greece, in gymnasias, where there were actually schools for boys where they have been receiving education together with physical training. In the training spaces, they put the statues of Olympic champions and prominent athletes so that the students could see examples to which they have to strive to achieve, to be like them. And having those examples every day in front of your eyes is very helpful technique, because our brain goes in a mysterious ways, but at the end of the day, what you focus on, you will receive. Another next thing in this octagram is train your emotions. It may sound controversial, but it is possible to train your emotions in a way that by training and regaining proper balance in your facial muscles, you also regain balance in your emotions. As I said, our mimetic movements is a highway in two directions. Not only our emotions affect our facial expressions, but also our facial expressions affect our emotions. To give a short illustration, try to imagine that you are very angry with somebody or with something. Then your face will take proper expression. The eyebrows together, teeth clenched, lips firmly closed, nose wings out, something like this. But now, if you imagine yourself angry, try to open your mouth like this and keep your mouth open for about 2 minutes. Next time you feel angry, try to do that experiment. After 2 minutes, one of the two things will happen. Either your mouth will close by itself, or you will stop being angry. Because it is not possible to experience emotion of anger with your mouth open. That's a very simple example of how our facial expressions can affect our emotions. Another aspect is visualize. Very important ability, visualize certain things and certain objects. Why it is important? Because one of the foundation techniques, very basic and very, very, very important techniques in our method is refraining from using a mirror. It again may sound contradictional or against the common sense, but in our method, we instruct our patients not to use the mirror. The explanation is fairly simple. For the patient who has some complications or residuals from facial palsy, the face is out of balance. So in most of the cases, the patient does not like what he or she sees in the mirror. That's why every time when he or she is forced to look in the mirror, she experiences, or the patient experiences, negative emotions towards that thing in the mirror, and that thing happens to be your face. The main issue is face that you have is the only face you will ever have. And also very important thing, this is the face that you may not hate or dislike. For a simple reason, this is your face, and it is your friend for life. It helps you in your life. And it is your friend who is at this moment is in trouble. And we do not leave behind our friends who are in trouble. We support them. We comfort them. We do everything we can to get them out of trouble. And that is what the whole method and the whole programs that we compose for our patients are aimed at. To learn how to help your face out of trouble. So in that task, visualization is a very important tool. Why? For example, same like in ancient Greece, the athletes were looking at the statues of Olympic champions and other prominent athletes. You can imagine in your mind your ideal face. You can imagine your ideal smile. You can imagine your ideal whatever facial expression you may think of. And that image will always be perfect because you are the one who has created it. You may pick your favorite picture, your favorite party selfie, whatever you may think of, or you just can imagine your perfectly symmetrical and balanced face. And you work on your program having that face in mind. That is very powerful. I cannot overstress how important this technique is, and we will talk about it a little bit later. Optimal nutrition have been written tons of books, so I will not stop on that, but it's obvious that if your food is healthy, then the resources of your body are much more vast. And if your food is, or your lifestyle is unhealthy, then the regeneration, the recovery capacity of your body is much less. So the result, of course, will be probably not as you expect. So if I may suggest, pay attention to what you eat, what you drink, and which kind of lifestyle you are having. Use your hands, going further clockwise. Use your hands. Well, these two instruments are the most powerful instruments you can ever imagine and you can ever have for your recovery of your facial movements. Why? There are several reasons for that, but the most important are two. First, the thing is that if you look at your motor cortex here in the brain, about half of the whole surface is dedicated by the nature to our hands and face. So if you use your motor cortex on your face, so as a matter of fact, if you use your hands on your face, so it is a half of your motor cortex surface is involved, which is very powerful. So it involves good coordination between those two. And then another aspect is your sensory cortex. So this cortex in your brain which is responsible for the sensory input. It's also about 50% of all the sensory inputs are in our hands or in palms, in the fingers, and in the face. So if you combine the motor cortex function, very active, and the sensory cortex function, also very active, and if you can combine and relate them very well, you'll have a very, very good results. And no other device, in our opinion, no other device in the world can be even close to the efficiency of these two instruments. That's one of our foundation principles. Going further clockwise, train your mimetic muscles. Important thing, because of course in a normal situation our mimetic muscles are working very finely and they are reflecting very precisely every small semitone of emotions that we are experiencing. But after the Bell's palsy or the facial palsy has happened, I often use Bell's palsy, but please understand that I mean any peripheral facial palsy that we can be confronted with. So when the facial palsy happens and it stays longer than necessary, than we would like to, we don't want to have it at all, but if it stays for long, then our volitional center of the brain, our rational center of the brain takes effectively over the management of the affected side. And that center can perform only very coarse facial movements because it simply cannot manage all those small semitones, all those faint small stripes of emotions that are achievable and accessible for the emotional center of the brain. That is why, and especially when it goes on a very high intensity, as we discussed earlier, it can only produce what is called mass movements. It's like standing next to the amplifier, next to the loudspeaker at the disco. You can only hear the roar and terrible noise, but you can't hear any music. But the more you step away from the loudspeaker, the better you start hearing the music, which means that the less intensive management signals become, the better manageable our facial muscles are. That's important. And the very last but not least, microstimulation. What is I mean by that? I've spoken that we don't use electrical stimulation and we don't think it's necessary. Correct. Microstimulation is not what is normally understood by electrical stimulation, because we have a very small device here in the clinic which provides the signals that are by their intensity comparable with the signals, with the intensity of signals that originate from the brain. So basically we are mimicking the signals from the brain in the direction of facial muscles through the small branches of facial nerve. So this way we mislead the brain, showing him that apparently muscles are working and they are active and they are in good tone and so on and so on. And by doing that repeatedly, we keep stimulating sensory cortex, remember, of our brain with the signals arriving from the area that is assigned to certain muscles. So our brain sort of wakes up and say, hey, this guy is functioning. I receive signals from him. Let's do something to support him. It's like a soldier. That is, when there is a connection with a soldier, radio, or any other connection, for that matter, radio these days, the command center keeps supporting him, sending him enforcements, supplies, ammunitions, and so on. And if the connection is lost, so the command center will say, well, this soldier is lost. It makes no sense to make any supports, ammunition to send anything. The good part about our facial nerve and our mimetic movements is that if you hear that after so many months or so many years, the facial muscles will suffer atrophy, and if you ask me if I agree with that, I would strongly disagree. From our experience, we conclude that the atrophy of facial muscles does not happen. Why? The assumption that facial atrophy would happen if the nerve is damaged after a certain time, the atrophy will happen, comes from the other nerves of our body. Why? Because the nerves in our body are all mixed. They are motor, they contain motor and sensory neurons that supply the same area. So if the let's say median nerve is damaged, then the brain can neither send signals to corresponding muscles in our hand nor receive any sensory input. Even if we touch it, we don't feel it. That means that our brain does not receive any signals from that soldier. So, well, he thinks, okay, that soldier is lost, forget it. Atrophy, no trophics, nutrition. So the muscle decreases its volume and can be replaced by other tissue. It's totally not the case for the face, because the facial nerve is almost purely motor nerve as far as facial muscles are concerned. It only provides signal from the brain to the muscles and nothing from the muscles to the brain. That task has been given to a trigeminal nerve, nervus trigeminus in Latin. So the nerve which is responsible for the sensory input from the face. That's why we experience toothache, we can feel the wind, we can feel cold, raindrops falling on our face, and so on. We can feel pain. We don't feel pain with our facial nerve. We feel pain and other sensations, of course, pressure, vibration, cold, warmth, and pain through the through the trigeminal nerve. And there's totally different nerve which is not being damaged by Bell's palsy. That is why, however small the sensory input from this area may be to the brain, it is there. So the brain knows that the facial muscles are still there. And by working with our facial muscles, by doing microstimulation or doing massages, I said to you that it was very good, but now I explain why it's not only good because of the blood vessels dilation and improvement of the bloodstream, but also because of that, because we are producing a massive, what's called afferent stream of signals. Afferent means from the periphery to the central nervous system. Efferent is from the central nerve to the periphery. Afferent, efferent. That's why. But now let's take a little bit closer look at certain techniques, and then we'll see some results and also explain a few foundational rules that we need to absorb and to accept for ourselves in order to achieve improvements. Let's have a look. Neuro-Proprioceptive rehabilitation. I just put the picture of this lady from Canada. She's from Vancouver Island, who has been having who has been following her rehabilitation program in the last year for about 1 year, 12 months. And you can see here her final picture in the center, her smile. By the way, her picture, the portrait, is now, with her permission, of course, on our what we call wall of honor. We have in our clinic the wall of honor, the pictures and portraits of our patients who have achieved their goals and have expressed their willingness and their wish to be placed, their portraits to be placed on that wall of honor. You can see her results. Here you can see her smile before and after. You have seen this picture before when I was illustrating synkinesis. Also her pucker kiss. When we started with her, it was in 2015, and she finished in 2016. Her pucker, you can see very clearly. Also her cheeks, blown cheeks. She couldn't do it at all because it was all distorted, this mimetic movements. But that's how she progressed. And again, I want to emphasize that the results are not achieved by us, not achieved by the clinic. They're not achieved by any magical intervention. They are achieved by the patient who is devoted, who is dedicated, who is persistent, and who is patient. Patient is patient. Yes. We show the way We learn together what to do, how to do, and what not to do. But the way to recovery has to be taken and followed by the patient himself or herself. That is very important that we all understand that, and that will be our starting point in our journey. We will start with microstimulation. Our working sessions, we call them working sessions because they're not only treatments, that they are working sessions because they consist of several modules, of which microstimulation makes one part. Microstimulation achieves multiple goals. First, receptors communicate with brain. As we just mentioned a few moments ago, our skin and muscles are filled with receptors. Touch receptors, pressure receptors, vibration, temperature, cold, warmth, and pain. All those receptors are related to our facial areas, certain muscles in our, as we know, sensory cortex. So when we do the microstimulation, we produce those signals, we mimic them, but still they are going that way to the brain, and we communicate this way with the brain in a proper and balanced manner. Blood vessels feed your skin, okay? Not only skin, but also the underlying tissue, which is also your facial muscles. They are, as I said, blood vessels, they become more elastic, they dilate better, so the network of capillaries becomes more detailed, it reaches more spots and places in the facial area and head, of course, and that improves the whole metabolic process, and of course it improves also the conditions for regeneration of facial nerve and recovery of functions of facial muscles. Facial muscles control expressions. When we do the microstimulation, our treatments, the facial muscles themselves, they are also sensitive to certain physical, mechanical, and electrical effects. So this way they become more elastic, more responsive to the signals that arrive from the brain through the facial nerve, and that makes it easier and more simple to control expressions in a way that we can manage our facial muscles in a finely organized manner. Nerve channels clean the pipes. Well, if you don't use something, we lose it. Use it or lose it. Nerve channels, because the movements on the affected sides or side of the face are much less intensive and less harmonious than on the healthy side, then the facial nerves and also nerves of the sensory nerve, which is trigeminal nerve, become underused, which means they lose slowly by slowly their capacity to do their job. They never use it completely, but still they become less fit for it. By doing the stimulation, we wake them up. So we make them conduct the signals, we make them produce the signals if we're talking about the sensory nerves, and this way they become fit, they become trained again for the purpose, and their purpose is to provide signals both ways, up to the brain, down from the brain to the muscles. And the last but not least, again, cellular membranes rejuvenate. Why rejuvenate? Rejuvenation is kind of word which everybody is more or less tired of and thinks, well, I've seen it all, I've heard it all, I know it. Yes, we do. We hear about it very often, but we don't always realize that to rejuvenate on a cellular level is to make the cell work in an optimal way. What I mean, cellular membranes, they cover, let's say, the inside part of the cell with all organelles and all what is inside. And the important part of the about cellular membranes is that these membranes are electrically charged. There is a difference in charge inside the membrane and outside the membrane, which means inside the cell and outside the cell. There is a difference in electric charge, and that difference makes cell life. When there is no difference between outside and inside of the cell, of the cellular membrane, the cell is dead. Why? Because due to that difference in charge, the exchange is possible between the outside of the cell and inside, intra and extracellular space. So through those channels, which you probably heard of, the cell exchanges with extracellular space with oxygen, CO2, glucose, other nutrients, small particles, amino acids, and so on that are necessary to build the cell and to replace the damaged parts of the cell. And that makes actually cell, I'm sorry, that actually makes the cell live. Its ability to exchange with the extracellular space. And that we can only have if the cellular membranes are charged properly. By the microstimulation, we increase that charge because the stimulation, the microcurrents, they are really so small and tiny that again we can approximate them to the signals arriving from the brain. So when the membrane charged more, the intensity of exchange up and down, in out increases, which in turn means that the metabolic processes increase, they become more optimal, and then it in turn means that the cell is doing its job in a better and more optimal way, which again means that the cell is functioning as a younger cell. That is why we use rejuvenation as a term here, and I think it's proper given the circumstances and given the application of that term. Let's talk about special rehabilitation techniques, which are very, very important. We have touched them a little bit during our discussion about this octogram. We'll start with symmetrical muscles relaxation. We use special what's called crystal touch face point. There are 2 points on our face, here and here, which we use from the very first working session. We learn how to use them. In the next slide, I will explain a little bit more about it. Ideomotoric exercises. Use your imagination. As you may remember, a few minutes ago, we discussed how you can make your brain work, do the job for you. You're using your imagination or using what's called ideomotoric exercises. Not all of you may be familiar with this term. I will tell you what it means. The sportsmen of Olympic class, the sportsmen who are training for Olympics, world championships, and so on, very often, not often, but on a regular basis, use this kind of exercise. They sit calmly in a chair or lay down on a couch, comfortably, with dimmed light, with or without music. They close their eyes and they play the movie of their sport movement, whether it be throwing the disc or the spear or swimming or whatever it may be, hitting the ball, pulling the weights, or doing some techniques for shooting or wrestling or boxing. They're doing those things in their mind up to a smallest, finest detail. They imagine as if they were doing it, but without moving a single muscle. This way, with full concentration, of course, they repeat and rehearse the movements, the patterns that they will later on will have to use during the competition. Actually, for the brain, it does not matter whether it sees or it rehearses the movement without actually engaging the muscles or with them. It's like a dam. On the inside of the brain, we imagine our movements, but the dam of the signals is closed and they are not going towards the muscles to execute the movements. That is very powerful technique because, for example, when you are training in your mind, ideomotorically, you train to smile. You can imagine your smile being symmetrical and being correct and being in balance and so on. But you don't try to execute that smile. That is very, very important. Why? Because when you are not yet fully recovered, or when you have some complications, contracture, synkinesis, and so on, the feedback from your muscles will disturb your picture in the brain. And your picture will not be ideal anymore because it will be distorted by the input, by the sensory input from your facial muscles that are not executing your commands ideally because there are some disturbing factors. Like I said, your volitional center of the brain that at will tries to amplify every single movement. But inside your mind, you can execute any facial movements you want without actually moving your muscles. And that way you are strengthening, you are firming your correct mimetic patterns in your mind without any disturbance from your muscles' sensory input. Visualization, internal mirror. We spoke about it. I will talk about it a little later with a special slide for that. And use your hands as a main instrument. We spoke about it already, and I cannot stress it strongly enough that these two instruments are the best ever things you can have to recover your facial movements, to bring them back to balance, and to regain your symmetrical smile and other facial movements. This is very, very important to realize and to use that instrument. Very important. Not only to realize it, it's also very important to use it.